Good afternoon. My name is Stephanie Limison, and I am a DNP student with East Carolina University. Today, I will be talking about what the Health Information Exchange is, federal and state legislation and recommendations related to the Health Information Exchange, and I will provide 2 recommendations for advancing implementation of the Health Information Exchange in North Carolina. The Health Information Exchange is an assembling of healthcare records and information electronically across organizations. These organizations can be within a region, community, or within a hospital system. This demand to exchange health information between healthcare professionals has been growing for years, largely due to nationwide efforts to improve the quality, efficiency, and safety of healthcare, which we all know is very much needed. The Health Information Exchange not only allows healthcare professionals, but also patients themselves to access and securely share health information electronically. This huge undertaking is being done by the Office of the National Coordinator for Health Information Technology, who is under the United States Department of Health and Human Services. There are many reasons that the Health Information Exchange is needed. First, having timely access to a patient's medical record or information can help augment a provider's decision-making process at the time of care, instead of waiting around 2 to 3 days for outside medical records to be requested and faxed, which is what currently takes place. Another reason is to improve medical diagnoses, as a provider can have a view of the whole picture and not just various pieces of the puzzle. Also, it can help to decrease the cost of healthcare, as there would be a decrease in the duplication of medical services and repeat testing being done. With accurate and up-to-date information, patients could potentially avoid readmissions. There also may be potential reduction in medication errors. The Health Information Exchange encourages a patient's involvement in their healthcare. It also eliminates unnecessary paperwork, which can increase the efficiency. And finally, it encourages collaboration among healthcare professionals. As you can see, the need for the Health Information Exchange is very clear, and the benefits are significant. On the federal level, the HITECH Act, or the Health Information Technology for Economic and Clinical Health, was enacted in 2009. This was part of the American Recovery and Reinvestment Act, or the stimulus law, which was enacted to stimulate different sectors of the United States economy during a time when the country was experiencing some of the greatest recessions since the Great Depression in the 1920s and 1930s. Lawmakers saw an opportunity to not only stimulate the economy, but improve healthcare as well. The HITECH Act allows the United States Department of Health and Human Services and the Office of the National Coordinator to establish programs to improve the healthcare quality and safety in regard to the Health Information Exchange. There are 2 committees within the Office of the National Coordinator. The first is the Policy Committee. They are responsible for recommendations to the coordinator about how to implement the requirements for the HITECH Act. The second is the Standards Committee, who is responsible for recommending standards by which health information is to be exchanged electronically. Both of these committees hold public hearings to allow input of the consumer. In regards to safety and security of health information, HIPAA extends to the HITECH Act. HIPAA is the Health Insurance Portability and Accountability Act, which was enacted in 1996 under President Bill Clinton. One of the main intents of HIPAA was to guarantee the privacy and security of health information. I think we all have had to sign a HIPAA form or 2 when we visit our doctor's office. Under HIPAA, 2 sets of federal regulations were implemented. In 2003, the privacy rule was started, which ensures the rights of patients to expect privacy protections of their health information. This rule limits the use and release of a patient's health information. In 2005, the security rule was implemented, which requires providers to protect their patients' health information, as well as guarantee its availability when needed. These HIPAA rules extend to the HITECH Act. This mandates that physical and technical safeguards are in place and also mandates periodically ongoing trainings of staff to maintain compliance. The HITECH Act requires that the United States Department of Health and Human Services provide yearly guidance on how to secure health information. The HITECH Act enhanced breach notification requirements of HIPAA and allows for appropriate handling of patient complaints. In 2014, the Office of the National Coordinator came out with a 10-year vision for the Health Information Exchange. By 2024, the goal is for a more connected healthcare system through an established nationwide health information technology infrastructure to allow improved information sharing. The goal will be a focused effort between federal and state governments as well as the private sector. In regard to state legislation, specifically North Carolina, in 2015, the North Carolina General Assembly established a state-run Health Information Exchange Authority, which operates the Health Information Exchange in North Carolina. This is called the North Carolina Health Connects. It is a secure and standardized system that allows clinicians to share patient health data. There are some requirements listed on the North Carolina Health Connects website. First, there is a requirement that certain hospitals, clinics, and clinicians under a certain statute who provide state-funded health services and have an electronic health record or EHR shall be connected to the North Carolina Health Connects by June 1st of 2018, which is just a few months away. All other providers who provide state-funded health services with an EHR shall be connected to the North Carolina Health Connects by June 1st of 2019. Local entities and managed care organizations are required to be connected by June 1st of 2020. And clinicians who do not receive any state funding may connect on a voluntary basis. The North Carolina Health Information Exchange Authority follows the same privacy and security rules of HIPAA and the HITECH Act. There is an opt-out policy for patients who have the right to opt out of having their health information shared. The North Carolina General Assembly commits around $8 million a year to this endeavor, and currently there is no fee charged for clinicians to subscribe to the North Carolina Health Connects. Now, there are a few recommendations I have for advancing implementation of the Health Information Exchange in North Carolina. I've been a practicing nurse practitioner in North Carolina for almost 4 years, and I have never heard of the North Carolina Health Connects. Now, one recommendation I have is to increase awareness. How are they getting the word out about this? I work for a smaller family planning clinic where we do have EHR and see a large amounts of patients with Medicaid. It's surprising to me that I've never heard of this. Also, how are patients being informed of this? This is also a service for them as well. Are they aware they can opt out of this exchange? Do they know their information is being exchanged? I believe more knowledge equals power, and there needs to be more information available for both clinicians and patients. Second, I would recommend more involvement from soldiers on the ground, to have more healthcare clinicians and professionals at the table involved in the decision-making process. When I was looking at the members of the staff and advisory board of the North Carolina Health Connects and the North Carolina Health Information Exchange Authority, there was one physician. The rest of the members were vice presidents, CEOs, engineers, etc. It is vital to involve those who will be actively using the system. For every successful project, key stakeholders need to be involved from the very beginning. This is a very large and very expensive undertaking, and I hope the clinicians were involved from the very beginning, and if not, they get them involved right away to help roll out a smooth process and implementation. Well, those are just a few of my thoughts on the Health Information Exchange. Thank you so much for listening, and I hope you have a great day. Thank you.